Hello, and welcome to Fall River State of Mind, a new podcast where we will have uplifting conversations on mental health for and with Greater Fall River's residents, mental health providers, and local leaders. Our goals are to explore local issues and current events concerning mental health in the Fall River area, to learn more about our local leaders, their work, and their perspectives on mental health, and to spotlight local mental health providers and programs doing good work in the Fall River area. My name is Owen Ivey. I'm a social worker, a mental health therapist, a certified grief counselor, an advocate, and a Fall River resident. Hello, and welcome to the second episode of Fall River State of Mind. Thanks for coming back. My name is Owen Ivey, and I'm your host. First, I want to thank all the people who listened and watched the first episode. We got a lot of great feedback. It seems like a lot of folks found my conversation with Nikki to be insightful and informative, which is exactly what we're here to do. I want to thank everybody who subscribed to the YouTube channel and also subscribed to our podcast feed, both on Apple Podcasts and on Spotify. If you haven't done so already, I'd really be grateful if you subscribed to wherever you're watching or listening to us. Today, I really want to get started and work on one of the primary goals of this program, which is to shed light on mental health treatment, especially mental health treatment available here in the city of Fall River. I'm hoping that today's episode will help folks who are thinking, you know what, maybe I do want to talk to a therapist, or you know what, maybe I do want to try medication, to take that hard first step. Making that first phone call or sending that first email or filling out that first form on a provider's website is the hardest thing to do, even if you know you need it. There's a lot of misconceptions out there about therapy, about psychiatric medication, about the whole field of mental health treatment. And if those barriers are keeping people from getting the help they need, I want to do my part in overcoming that. Thankfully, though, we have seen a recent uptick in people taking advantage of mental health treatment, both mental health counseling and the use of medication for mental health issues. Roughly 20% of American adults are currently on a medication aimed at helping their mental health. We also find that 15% of American adults, are in mental health counseling or have been in the last 12 months, which is a great thing. People aged 18 to 40 are in therapy even more than everybody else. About 1 in 4 people aged 18 to 40 are in mental health counseling right now or have been in the last 12 months. These are great numbers. But there are still some groups that aren't coming to therapy or getting the help they need as much as they should. Women still attend therapy more than men. White folks still attend therapy more than people of color. And in the case of Hispanics, white folks come to therapy twice as often. Now, this is for a myriad of reasons. There are systemic injustices that prevent people of color and other marginalized communities from accessing therapy or psychiatric medication. There's a lack of providers in some of these communities. There's also language barriers and issues with cultural competencies that keep people away. The field of mental health treatment needs to do a better job of meeting the needs of these populations and attracting them into therapy. I think today's conversations will go a long way towards addressing some of the misconceptions about mental health counseling and psychiatric medication. So thank you again for joining us today. I hope you enjoyed these conversations as much as I did. So for my first guest today, I wanted you all to hear from somebody who can speak to the practice of mental health counseling from a lot of different angles and from a lot of different experiences. Today I speak to Fall River licensed independent clinical social worker Julia Nepini. In a modest amount of time, Julia has accomplished a whole lot in the field of mental health counseling. Julia owns and operates Compassionate Counseling Company, located right here in Fall River. Nowadays, she also runs a successful consulting company where she helps other mental health professionals grow their counseling business with integrity. This work includes her own podcast on that topic called the Compassionate Climb Podcast, which is available on Apple Podcasts. I hope you enjoyed the Spotlight segment with Julia as she offers us unique insight into the world of mental health counseling and shares information on her increasingly successful group practice. Hi, Julia.
Hello. Thanks for having me
Yeah,
today.
thanks for coming in. Like the coldest day of the year so far.
That's
so
okay. Like I said, the cold makes me feel alive.
I know. You walked in without a jacket.
I won't tell my mom.
Becoming the bravest person I know. But thank you for joining me. This is something obviously I'm familiar with, but I didn't want to be the one to talk about it. I'm curious, and I think people will be curious. How did you come to this work? How did you find your passion in this work?
I would say I was born a helper. So just birth order, being the only girl, having younger brothers, it was an inherent personality trait. And then when I went for my bachelor's degree, I was simultaneously taking a sociology and a psychology class at the same time. And I found myself, although fascinated by the brain, even more fascinated by people in their environment, learning about different cultures and societies. And so that was the route I took. So I got my bachelor's in sociology. They had a 4-course sequence. It was a specialization in social work, a certification, and I went for that. Did a lot of community service. I went to St. Anselm in Manchester, and then I went straight on for my master's and never looked back.
You know, it's funny how the work kind of calls you, whether you're looking for it or not.
It does.
As I said in your intro, you started out in private practice, is my understanding. You now run a very successful group practice. From all those experiences, what do you consider to be like one of the most like rewarding parts of the work for you?
There are a lot of rewarding parts of the work. I would say early on, when I was still seeing a caseload, it was definitely seeing that progress, being in those sessions where someone's sharing something with you that they've never shared with another person. Or you see these aha moments and they're saying things like, I never thought of it that way, or that's a really good point, or you see that it's affected them in some way and the gears are turning and then they come back with these epiphanies. So I loved the clinical work for sure. I would say now a lot of the highlights for me are being able to provide a really positive work environment. We provide good compensation and all the benefits and can really provide this balance between doing really good work but also making sure that we prioritize well-being and people's families and travel and their other interests. So now I primarily spend my time, I would say it's split between managing the group practice and business consulting. Yeah.
And I mentioned that in your intro too. Fascinated by that. But the whole reason, the biggest reason you're here is I want to tell folks who are listening, and it's going to be people who maybe know they'd benefit from talking to a professional, and they just haven't for different reasons. It might be people who are, already working with a professional, but don't maybe understand the whole dynamic. I want to give folks a little bit of like a 101 crash course. So as far as you can tell, and based on your experiences, like who's a good candidate to start up mental health counseling?
The types of clients that we tend to see are those that are really struggling with a mood disorder. So they've had some type of a life transition and they might notice that their functioning is not what it typically is. We see people that are struggling with depression, anxiety, but then even from there, sometimes some more extremes, a lot of chronic suicidality. So they might be thinking about ending their life on a regular basis and trying to manage that. Some bipolar, some gender identity, and then it just goes from there. Grief is a big one. So when people have lost someone that they care about, or a relationship has ended, or they've lost a job, or even chronic pain or illness and some of the medical things that can come up unexpectedly that we have to deal with. A rule of thumb would be if you are looking for a deeper understanding of what's going on in your world and maybe you've exhausted your own resources and that doesn't feel like enough, you'd have this designated time to sit with someone that's really trying to learn what life is like through your eyes and can give you this bird's eye view and sometimes perspective that is hard for us when we're in it.
Well, totally. And the question I get a lot is, well, why do I need to go to therapy when I have, good friends and good family? And that's a blessing. That's an asset.
Sure.
Don't discount that. But the therapist-client relationship is special in that, in that hour, we are trying to help you work with your pain, your suffering, and find your own way through it. What do you see as some misconceptions? And that can be like broadly speaking or maybe more locally. What are some misconceptions about mental health counseling?
That you should only come to therapy when you have a problem, or that if you're struggling, there's something wrong with you. It's very interesting to me that when you do have that therapeutic relationship with someone, there are very often times these moments where the focus is on all the externals. So it's the people that we're in relationship with, it's our boss, it's our kids, it's everybody else. I think what it really comes down to is that we are the only ones that have ultimate control over our lives and happiness. So it is about us, and it doesn't necessarily mean there's something wrong with us. We're learning to manage and trying to cope. And so I think that that's a big one for sure. Another one is, I think, the way that therapy is portrayed in a lot of media, whether that be movies or TV shows, is not always very accurate. So even though we do have really comfy couches in the office, the pandemic has really transformed how therapy is offered. Mm-hmm. So very oftentimes it can be virtual, and sometimes people are receiving therapy from the comfort of their own home or maybe parked in a car outside of work. So I just think that that's evolved a lot. And even though we want you to be comfortable, people are very rarely laying down on a couch and talking about their deepest, darkest secrets.
See, it's funny you say that. Have you ever seen the show Shrinking on Apple TV? Yeah. I got so excited in the first couple episodes because I'm like, you know what, this is a fairly, that most of this is fairly accurate in terms of its depiction of like human beings doing this work. They wear jeans, they have problems, they're flawed, they're going through things and trying to work and still serve their clients. Like, that's all great. And then this guy, not to spoil it for anybody, but then this therapist, invites one of his clients to like live in his house. And I'm like, no, where did we go wrong? So even some of the best representations we have in media, I think, are still pretty flawed. And I worry about
high entertainment value.
Well, yeah, great, and great acting. Harrison Ford in that show was absolutely amazing. But so I'm sure there are people out there, or I'm hoping this is reaching people out there who feel like, well, I want to go to therapy, but I just can't. And I want them to feel seen. I want them to feel heard. What do you see as often the barriers for people coming to therapy?
A lot of times it's still stigmatized. And I know even in my own family, one generation removed, there is some mental illness and not necessarily these diagnoses or people really getting to the bottom of what's going on. So I think that's still very real. Accessibility is better than ever, but I'm sure it's hard when someone's been struggling to pick up the phone or to take that action sometimes. So we really try to make it as easy as possible for people to reach out in all different ways. They can reach out by phone, they can fill out a form on our website and get a call back. And we also try to text people or email because sometimes a phone call can be really intimidating.
You tell me, in a working class city like Fall River, it can be really simple things like, I have to work a 9 to 5. How do I get to therapy? I mean, I'm sure you guys do plenty of like evenings and weekends like I do.
That is absolutely the most in-demand time.
Yeah.
So we've actually offered incentives as an employer to try to draw in the right people, and fortunately we have. So we have a male therapist that's going to be starting. He's going to work on Sundays and Mondays into the evening. And so we really try to allow for flexibility and autonomy in scheduling, but always try to be mindful of the need.
You hit the nail on the head, especially here in Fall River. There still is stigma, especially in certain circles, certain cultural backgrounds. Still a lot of stigma about therapy. I'd like to think that's starting to change. How do you feel about telehealth? Do you see it as like a co-equal, like viable option for people? I mean, do you have concerns about it? How do you feel?
I think everyone has their personal preference, clinician and client alike, but I have seen firsthand that it can be just as effective. I will say that it introduces some new elements. So not only does someone have to have reliable technology and privacy, people do tend to get a lot more distracted when they're in their own home. They might have other family members there, their pets. So I would say also depending on attention level and someone's age. So there's just a lot more considerations, but it has absolutely provided accessibility to people who would have really struggled to get therapy otherwise. So I think it can be effective, and we just have to be mindful of the nuances.
Yeah, I personally find so much of the magic of therapy to be like human to human in the room, the energy kind of going back and forth. Sometimes just the way you look at somebody, it can just like, the kindness can just be in your eyes. I fear that gets lost, through the computer screen. But again, if geography is a problem for you, if scheduling is a problem for you, the telehealth therapy that's here now is a beautiful resource, and I hope people take advantage of it. So I want to shift in our last few minutes here, shift the focus to your practice. I believe it deserves a spotlight. I believe you guys are doing great work over there. You're growing like crazy. So first set us up, because I'm a therapist, but I work in private practice, just like you did. What's the benefits of going to someplace like Compassionate Counseling, where it's a group practice, versus seeing a clinician in private practice?
So I can see a private practitioner who really specializes in whatever they're struggling with, and also, as you said, the therapeutic relationship is everything.
Yeah.
So I think that can be really helpful, but now that we've started to expand and we have that ability to bring on prescribers and offer medication management, there's that continuity and collaboration, and it can be really tough to get a provider on the phone. We're in and out of sessions or appointments all day long. So to be able to send a message or go down the hall is invaluable. I would also say that we have so many different specialties within our practice, so we can pick each other's brains, but we can also have one client who's seeing one clinician, let's say for talk therapy, and then they see another clinician for EMDR, for example, or they might be seeing someone for couples counseling and then they see someone else for individual. So we really do serve the whole family, all ages, a multitude of issues. We have clinicians certified in perinatal mental health. We have clinicians that specialize in all different issues. So I think that adds another component.
So in the final words here, tell me what makes Compassionate Counseling unique, because there are other group practices here in the area. And then please tell me how folks can find you, connect with you.
So I would say what makes us different is our mission. So for us, it's always about affordable, accessible, quality mental health treatment. So we will likely always take health insurance. Even though that brings a whole host of challenges, we don't want costs to ever make mental health treatment prohibitive. We want it accessible and for people to be able to seek that out. I would also say the culture and the team. It is so far beyond anything I ever could have envisioned. I worked in community mental health. I worked in a hospital. I worked in child welfare. I was all over the place, and I've never experienced anything exactly like this. It's just a group of people who are not only supportive and collaborative, but really want each other to win. And we are going to have our holiday party coming up this weekend, and I just can't wait to be in the same room with the majority of them to be able to celebrate. 2025 was an incredible year. So,
yeah, tremendous. Yes, congratulations. I speak very highly of your practice. So you're on Hartwell Street, is that right? Yeah,
yes,
I've been in that building. I love that building. I'm kind of jealous.
It's got some character.
But I found a good spot. It's okay. It's a great building. You guys have set yourselves up nicely there. But you have a website?
We do. It's Compassionate Counseling Company, all spelled out, .com. And give us a follow on Facebook or Instagram. We put a lot of energy and effort, and our clinical team lead, April Lacey, I got to give her a shout out. She does a great job on there. So it really gives you a window into our world and what sets us apart. Thank
you so much, Julia. I appreciate your insight. And please keep up the good work. I know it's really hard some days. Yeah. I can speak from experience. But keep it up. This community needs good providers like you guys. But thank you for being here.
Likewise. Thank you for the work you're doing and for a platform like this to be able to talk about it.
Thank you for saying that. So as much as I think mental health therapy is a primary ingredient to good mental health, there have been multiple studies that have shown that the most successful outcomes we see in mental health treatment is when somebody is receiving mental health counseling while also exploring the option of medication. So for my second guest today, I wanted to speak to someone who could speak to that second piece, the world of psychiatric medication. Today I'll speak to local nurse practitioner Lisa DeJesus. Lisa has been a nurse for 15 years and has a dense background of clinical experiences in substance use, mental health, healthcare, and palliative care. In only a few years, Lisa has built a successful private practice, which then became a group practice, offering medication management to folks struggling with a host of mental health issues. I've seen firsthand her practice, Healing Minds Psychiatry, do tremendous work with folks who could not find the proper support elsewhere. Please enjoy my chat with Lisa DeJesus. Lisa, hello.
Good morning.
Thank you for being here.
Thank you for
Freezing cold outside, and the college where we record this is having like their opening day ceremony. So I had no idea. I'm sorry about that, but you probably navigated through a whole mess of people to be here with me. I'm grateful. So folks listening and watching the podcast will have just heard from me and Julia, who talked about mental health counseling and what's that all about? What are the misconceptions about it? How do people make the most of it? What we see, there are studies, multiple studies have shown that mental health treatment is most effective when folks are doing therapy and getting the medication piece simultaneously, right? So I definitely wanted you here to talk about that. That is your bag, as they say. So tell me, how did you come to be in this work, doing prescribing psychiatric medication?
So I started as a nurse. Well, even before that, I've worked in the community in Fall River for many years, and as a visiting nurse in the community, I saw a lot of challenges with a lot of my clients being able to obtain service and engage with, especially medication management at the time, and it really inspired me to want to help meet that need.
Well, that's the field now, right? I mean, I think 25 years ago, the only people prescribing these medications were like psychiatrists.
Correct.
And there weren't a lot of them, and a lot of them kind of shady folks. But anyway, the newest trend, a lot of the people doing this work are people with a nursing background.
Yes, and I wanted to provide, I wanted to increase the accessibility and be able to meet those needs without so many barriers.
Just share with us, I'm curious, a recent example or digging back into the past, what do you find to be a rewarding part of this work or a rewarding moment you've had?
Well, there's so many, I feel.
I hope so.
Just building the connections and, working with so many different people from so many different backgrounds and, building those relationships, I think, is the most important, and seeing progress and growth and, just feeling
people's lives getting better, right?
Exactly.
Who in your mind is a good candidate to work with somebody like you and try medication for whatever they're dealing with in mental health?
Well, I think, medication has, a space in mental health in different situations when symptoms are impacting, relationships and work and daily functioning in some way. More moderate and severe symptoms sometimes require medication management. Not always, but there is a population, and sometimes it's lifelong, and sometimes it's short term.
So you mentioned medication going hand in hand. I brought it up too, going hand in hand with therapy. How do you see that playing out ideally? Is it doing therapy at the same time as?
I strongly encourage it. I don't mandate it.
For your patients, you mean? So if you're prescribing meds, you don't? Because some places do.
Right.
Yeah.
I personally believe that if you're making somebody do therapy, they're not getting the most out of it. So, but I do, I've worked with some individuals for over a year, and I really think therapy could really benefit. The medications, again, is just the small sliver, and it's over time they'll agree to they'll explore it, and I've seen huge benefits and changes, but it comes from them.
So what do you think are some misconceptions about medication when it comes to mental health? Like people come in and have the wrong idea.
The big thing is that it's going to fix everything. That there's a quick fix or a magic pill that's going to...
You would tell me if there was one, right?
Yeah. We would all have one.
But no, I do hear that.
I do think that is, that's challenge, this isn't working, and again, it's going to take a combination, and and it's just a small step.
How about things like side effects? I mean, do people have misconceptions about the side effects of medications? Or
side effects can be challenging.
Oh, yeah, sure.
And some people experience them more than others. Everybody is an individual. And, one thing that we do unique, we use psychogenetic testing a lot. Which helps us, medications are designed to work a certain way, and our bodies are all individualized, and how that medication is going to break down and metabolize, and each individual is going to be different. And it's not the be-all, end-all, but it does help guide medications that may, provide for less side effects, right? Might have
side effects are a real thing, like you said.
Common side effects are, GI upset and sometimes headaches, and they usually, for the most part, can be short-term.
So I was curious. I wanted to ask you what you see are, the challenges to folks finally coming into the office for the first time.
The stigma has been a long-term,
or
a long time, concern. I do see a little bit more of a change in that, and I think it's mental wellness, mental health.
Well, and I think people talk about it more openly now. Like, I've been at family gatherings and people come in and say, "What a great day! I'm on a new antidepressant and I feel great." And it's like, okay, well, I didn't think that was going to come up right away, but that's fine. What other challenges? I mean, do you see folks experiencing trying to start medication or working with a psychiatric provider?
We mentioned a little bit about accessibility. Wasn't always there. I think, that is changing. We do have a lot more providers, and, I think some of the challenges, transportation, telehealth has been great. But
you guys do a lot of telehealth, which, brings it right into people's homes,
Yeah.
Insurance is a barrier. Copayment might be a barrier. Copayment for the session, but then also for the medication at the pharmacy, right?
Yes. Which, that can be very challenging, right?
So for the the last couple minutes here, I'd like to give you an opportunity to plug your practice, Healing Minds Psychiatry, which I already said in the intro, located in Tiverton, also located in Somerset now. But what do you think sets your practice apart? What are you proud to say is unique about your practice?
Well, I think we touched on it a little bit, but I do like to provide the holistic approach. I have some more staff that work with, helping to, with referrals.
Helping your patients find other supports,
My clients
That's
find
tremendous.
other supports. So we also have a family nurse practitioner, 2 actually now, that can help with consulting when there's a challenge in getting primary care.
Okay. Wow.
Providers out there's long waits.
Yes, there is. Yeah. You do seem to be patient-centered, really being mindful of the patient experience. So tell folks, we gotta end, but tell folks, how can they find you? If they're interested in working with you, how should they do that?
They can visit our website at healingmindspsychiatry.com.
Excellent.
And we have a nice little button that says new client, just a little tab.
You can refer yourself right there on the website.
And they can also give us a call, 774-300-3444.
Perfect. And I'm going to put the website and the telephone number up on the screen right now. Because I want folks to reach out to you if they're interested. I think you guys do great work. So thank you again for being here. I really appreciate your insights into this work. I do think there are still some big misconceptions out there. I hope the conversation we had today did a little bit to put an end to those misconceptions. And if anybody out there has been considering making the call, I hope after hearing this, they're a little bit closer to making it. So thank you.
Thank you, Owen.
Well, that's that for this second episode of Fall River State of Mind. Thank you again for joining me. If you found any of the information in this episode helpful, please reach out and let us know. Also, you could send it to a friend or a coworker or a family member so that they can maybe learn more about the world of mental health treatment. It is through education we're able to reduce the stigma around mental health treatment and increase the rates at which the people who need it most are getting the help they need. Thank you again for joining me. My name is Owen Ivey. It's a pleasure and a privilege to do this with you. I look forward to seeing you again next month for our next episode. For now, this has been Fall River State of Mind.